Mr. President, for the past decade, health policy, unfortunately, has proven to be one of the most bitterly partisan issues. It doesn't have to be this way. I want to take a few minutes to discuss some health-related issues that Congress left unfinished before the holidays. Providing relief from the medical device tax, reauthorizing the Children's Health Insurance Program, and funding for community health centers, and doing more to address the opioid crisis. Each has strong bipartisan support and could provide help to our constituents now. First, many of us on both sides of the aisle agree on the need to provide relief from the medical device tax, which went back into effect on January 1st. The medical device tax is one of those issues that leaves most Hoosiers scratching their heads. First adopted as part of the Affordable Care Act, the device tax was one of the few issues that Republicans and Democrats agreed needed to be fixed. And in 2015, with bipartisan support, President Obama enacted a 2-year suspension of the tax. The argument was really pretty simple. The medical device tax was making it harder for innovative companies to invest in the research and development of new technologies, and in the process, we were stifling job creation. If there was a question as to whether this was the case, the last 2 years provided evidence. When we agreed to suspend the tax in 2016 and 2017, manufacturers used that additional money to hire new workers, invest in research and technologies, and continue producing innovative life-saving products here in the United States. For example, Zimmer Biomet, headquartered in Warsaw, Indiana, my home state, used the money from the device tax suspension to invest in new innovation to improve musculoskeletal health across the world. They were also able to upgrade their manufacturing equipment and facilities. Perhaps more importantly, these investments not only supported existing jobs, but they also helped to create new jobs, new good-paying jobs. Yet despite this evidence, despite the strong bipartisan support for repeal, and despite a wide-ranging package of changes to the tax code becoming law in recent days, Congress has failed to address the medical device tax, which went back into place on January 1st. As we again discuss the policy priorities that were left unaddressed in 2017, I strongly urge my colleagues to work with me to quickly and meaningfully address the medical device tax. This would allow these innovative companies to make the long-term investments that not only lead to life-changing technologies, but support thousands of high-paying jobs across the country, including in my home state of Indiana. Another issue that has garnered bipartisan support is a health care program that covers millions of our children. We must reauthorize the Children's Health Insurance Program, also known as CHIP, that expired in September. I have long supported the CHIP program. It provides health coverage for millions of kids, including nearly 115,000 children from Indiana. I'm not alone in my support for this program. The fact is, CHIP has had strong bipartisan support for the past 20 years. And Democrats and Republicans in both the Senate and the House have shown they support a 5-year reauthorization of the program. That gives states the certainty they need to plan their budgets and provide high-quality care to these children. Despite this shared commitment for the program and agreement on the need for a long-term reauthorization, we were only able to fund the program through March, before Congress departed for the holidays. This short-term extension bought some time, but according to the Centers for Medicare and Medicaid Services, CMS, some states will start running out of money after January 19th. This means families and states will very, very soon face the harmful consequences of congressional inaction. Just last week, the Congressional Budget Office said that funding the CHIP program for the next 5 years will cost significantly less than previous estimates. This program is vital to our families, vital to our children. We should reauthorize the CHIP program right away. Like the CHIP program, community health centers have enjoyed long bipartisan support for the high-quality care that they provide to our families. Also like CHIP, the funding for the Community Health Center expired on September 30th, leaving many health centers across Indiana worried if they will have the resources they need to continue to serve Hoosiers. We have the ability to work together now to ensure our community health centers can continue to provide cost-effective, high-quality health care to people all across the country. Finally, we've demonstrated a common desire to address the needs of the opioid and drug abuse crisis. It is a scourge. It took the lives of 63,000 people just in 2016. 63,000 of our brothers and sisters, our husbands and wives, our sons and daughters. It is a heartbreak that is crushing the entire country. I welcomed President Trump's declaration of a public health emergency, and both Republican and Democratic senators have highlighted the need for Congress to do even more to help those struggling with addiction. Like many other states, the opioid epidemic has been particularly devastating in underserved areas in Indiana that lack adequate treatment providers. Senator Murkowski and I have partnered on a bipartisan bill that would encourage addiction treatment professionals to serve in underserved areas by making addiction treatment facilities eligible for National Health Service Corps student loan repayment and forgiveness. We can show our commitment to increasing access to treatment by reauthorizing the National Health Service Corps program. That expired in September. We also must recognize that a meaningful response to the opioid crisis will require robust and meaningful funding to help our communities as soon as possible. I've often said that most people think that Congress can do something to help make life better, to provide working parents with the peace of mind that their children can grow up healthy, and to install confidence in our communities that they'll have the tools they need to respond to this heartbreaking crisis. At the very least, Congress should not make this situation worse. By failing to take action in 2017, medical device companies are once again paying a counterproductive tax that inhibits growth in Indiana. Together, on all of these issues, on medical device taxes, on our families, on our children with this opioid crisis, with community health centers, on all of these fronts, we can work together as Democrats, as Republicans, but more than either of those, as Americans, to make sure our families can get decent health care, to make sure that no one else dies because of this terrible opioid scourge that we're dealing with. These are critically important issues. These are issues that know no political party, that know no special agenda. What they do know is they need this Congress, this Senate, to deal with them now. Mr. President, I yield back.